Okay. Can everyone hear me?
Yep.
Yes.
Can people hear me? Okay. Yes. Good afternoon mga kababayan. Good afternoon everyone from the Philippines, Filipinos everywhere, whether you're from Manila, whether you're from anywhere in the Philippines, you're from UAE or in New Zealand, elsewhere. Magandang hapon, good morning, good evening. Hi everyone, I'm George Ramos. I will be your facilitator for today. And yes, we would like to welcome everyone to our webinar. No, if I'm not mistaken, marami ang nag-sign up for today. No, they're like uh, from what I know from the last count, there were like 800. So hopefully, at least we would be able to accommodate everyone because I know everyone is excited for today. So our webinar for today is all about 100% employment outcome for the Filipino health workers and frontliners. And as I've mentioned, we will be having a very good discussion because we will be going through the technical aspects of it. And then we will also hear from somebody no, what it's like to be a nurse or a health worker in New Zealand right now. Ano ba yung buhay ngayon doon? And then of course, we're going to also understand what's the process or what's the steps no, necessary for us to be able to start going there. No? And hindi ko na patatagalin. Before that, I would like first to introduce everyone. Siguro, just so that everyone would get to know sino ba ang dito, no? I'd like to introduce first, we're actually five in this, no? And then siguro isa-isahin ko lang very quickly lang. The guy on my right, tama ba? Right or left, depending on where you're standing, is Paul. Hi, Paul.
Hi.
Yan, Paul. Paul is our sponsor. He's the one who organized this.
Hi there.
All right, and then of course, our lady, our beautiful lady on the right is Prime. Prime Melendres. Hi, Prime.
Hi guys.
Hey, so Prime will tell us her story later. No, Prime is a shining example of what it is exactly what the life is right now, no, for healthcare workers in New Zealand. And of course, I'd like to introduce also Jay Aranas. Jay, hi Jay.
Hi, George. Hi, everybody. Good to see you guys.
Batang-bata ah.
Okay, and of course, let's go to Fatima.
Sammy Belmonte.
Hi everyone, Kiara. This is Fatima from New Zealand School of Education. I hope everybody is keeping safe and well.
All right. Okay. So, first of all, before we start, I would suggest to please mute your microphone so that we don't experience any background noise while our guests are speaking. Okay lang ba yon, guys? Ready? Okay. So, yan. So, thank you, everyone. We'd like to welcome you, lahat ng Filipinos listening right now. Can we, everyone, para makita lang natin yung mga faces ninyo. Gusto lang namin, isang kaway lang tayo, isang kaway lang. Yan, hello. Kumusta kayo? Kamusta? Yes, very good.
Hi.
Maganda.
Yes, that's
Maganda, tsaka mga pogi. Yan. Pero mas maganda kung maganda. Yan. Yan, alright. Okay, so sige. Siguro, I don't want to hold you. Obviously, the first question that you will be asking is, why are we even here? Why are we even in this session right now? No? And sabi ko nga, deep dive na kagad tayo. No? What is this thing all about? No? And siguro the best person to answer that is actually the person where, or the person who's representing the institution where it's actually best to study in New Zealand. No? Okay, so because this is an education program, no, we would like to emphasize that this is this is perhaps the best way, no, to prep yourself and use this as a jumping board to be able to accomplish your migration aspirations. No? So with that, I would like to introduce to everyone the International Marketing Manager of NZSE, NZS tama ba? NZSE, no? And she'll be able to help us, no, better understand or untangle the mystery behind this whole program, no? And I'd like to specifically ask everyone to please listen intently and take notes. Meron naman tayong replay, pero it would be best kasi baka mamaya, who knows, technical difficulties, no? Hindi maayos yung replay. It would be better if we would just take notes, no? So I would like to call on none other than Miss Fatima Sayed. Hey, Fatima.
Hi, thank you for the lovely introduction. And I would like to start my session by saying that in this COVID-19 situation, we all have understood the importance of healthcare industry. And this is the reason why today I would like to cover up one of the most important program, which is right now, frontliners are very much in demand. So without wasting much time, today I will introduce my program, Diploma in Community Healthcare and Support Level 7. I would talk about that program in detail. So please confirm to me if you can see my screen, anyone.
Yep.
Yes, we do.
Yep.
Very clear. Thank you, Fatima.
Yeah, okay. So NZSE or NZSE, New Zealand School of Education, is a category 1 private training establishment, and we have campuses in Auckland and Hamilton. In Auckland, we have campus in Newlyn, Manukau, and CBD. My college is one of the best college when it comes to healthcare department. I will tell you more in detail why we are one of the best in India. But I would like to start by saying that understood the important 5,000 people aged over 65. By 2036, there will be more than 1.2 million people 65 or older. Combined, this will give you an idea that New Zealand aging population is increasing in New Zealand. If you see the graph, program is a very unique program that focus on meeting the needs of geriatric and palliative care clients. The aim of the program is to develop non-clinical health professionals who are able to work in a holistic perspective to enhance the well-being of individual, families, organization, and communities. If you see the bar graph, this will give you an idea about how the elderly population is growing in New Zealand. If you see the orange graph, that will give you an idea that it is projected that in a period of 40 years, there will be a 700% increase of the total population in 95 plus age group, if you see that. And similarly, 283% in 80 plus and 108% in 65 plus. If you see the other graph, that will give you an idea about how, the aging population is increasing in New Zealand. In a period of 40 years, there will be a 203% increase in the Asian population, 150% increase for Maori, 110% increase for Pacifica, and 50% increase in the NZ European population. So now this graph gives you an idea that New Zealand aging population is steadily increasing, creating a demand for trained community workers and caregivers. The second diagram will give you an idea about the projected demand of NZ residential care worker in the next 10 years. So if you see the caregiver section, it is projected that in a period of 10 years, around 15,731 jobs are projected to be created in the caregiving sector, and employment is expected to be quite stable out of 2025. Now, let's talk in detail about my program, which is Diploma in Community Healthcare and Support Level 7. This is a 39-week program of one academic year. There are total 7 papers with total 120 credit, 30 credit work placement, which is internship for 8 weeks, and 15 credit research. Now, this is very important. This is the only program where you will get the research and internship together. Class timing 4 days a week, and campuses we have Hamilton and Auckland. But if you study in our Hamilton campus, as per the current immigration policies, which are valid till December 2021, you will gain a 2 years post-study work visa. Now, what are the main components of this program? We have primary healthcare rehabilitation, professional practice and legislation, research for healthcare practice. The research paper will also help you if you want to, study further, maybe your master's or anything. Research paper will have a weightage, palliative care, geriatric care, and work placement. Now, along with this program, like our broad range of courses cover different skill set required by the industry and provide learning based on problem solving, practical application, investigation, case studies, dealing with real life examples in a practicative learning environment. Along with the program, you will also get complimentary first aid certificate and voice training. Now, what are the employment pathways of this program? So the graduate of the diploma in healthcare support level 7 will be able to seek employment in a range of workplace. So if you want to go into geriatric, you will be working with retirement villages, rest home, hospital, in-home services. As you can see here, elderly care organization, acupuncture clinics, massage and reflexology clinic. Palliative, you will be working with hospice, rest home, in-home services, retirement villages, elderly care organization. And if you want to work into research, health research, you will be working with the district health board and research organization, health promotion, government and non-governmental organization, community workers in various health and well-being field. And if you are from the nursing, physiotherapy, medicine or medical technology background, post completion of this program, you can even work towards your registration. For example, if you are a nurse, you have completed this program, you want to enhance your career further in nursing, you can even go for the CAP program, which is competitive assessment program. And post that, you can even apply for your registration. So now let's talk about the campuses. Like I said, we have Hamilton and Auckland campus. We have multiple intakes. So don't worry. Currently, I understand, students are quite worried when we will go. And as soon as the borders open up, we will have multiple intake in every almost 2-3 months. The academic requirement for this program is degree level qualification in any science discipline or a level 6 diploma. I think Jay, my colleague, would be able to cover up further, like how a Filipino student will be able to qualify for this program. So if you are a level 5 diploma in health or associated field, then we would require a 1-year work experience. And the English requirement is overall 6 band with no band less than 5.5 in each module. The total tuition fees for Filipino student is 15,000 New Zealand dollar. I repeat, 15,000 New Zealand dollar, including the admin fee and course related costs. All international students must have a valid insurance to travel to New Zealand and study in New Zealand. Now, this is very important, guys. Please pay attention. Minimum wages. So on 18th April 2017, the government announced a 2 billion pay equity settlement for 55,000 care and support workers in New Zealand. So what does this mean? If you see the graph, this diagram, you will see level 4. So level 4 is the highest qualification there, and students who have studied level 4 will get around 25.50 New Zealand dollar per hour from 1st July 2019. And our program, Diploma in Community Healthcare and Support, has accreditation with Career Force as a level 4, which is the highest in the pay equity bill. So just go and Google, you will see the pay equity bill, which all colleges are there, universities are there, NZSE is there. And we are very proud to say that we have 100% employment outcome. And students who have studied from our program will get minimum 25.50 New Zealand dollar per hour after completing this program. Now, as a graduate of this program, you will possess both the skills and hands-on experience to enter New Zealand's bio and healthcare sector with confidence and assurance. 100% employment outcome for our graduate. We have strong relationship with NZ Health Organization, excellent career support services. Now, new policies which came into effect from 30th October 2019. So I hope you guys know that personal care assistant 423313 is now on the list of ANZ SCO occupation, treated as exception. Jay would cover up more details on this, but this occupation, personal care assistant, is there on the ANZ SCO list. And with pay equity at 25.50 per hour, our graduate will be eligible for being awarded skilled migrant residencies visas. And if you study in our Hamilton campus, student can also be eligible as per the current immigration rule. I repeat, as per the current immigration rule, which is valid till 2021, to get a 2-year post-study work visa after graduation. But if you study in Auckland, you will get 1 year study, 1 year post-study work visa. If you study outside Auckland in Hamilton campus, 1 year study, 2 years post-study work visa. These are the some of the testimonial from our students like Ivy Carroll. I would play some of the testimonial for you guys, so I'll not repeat this. And if you see this slide, this will give you an idea about NZSE graduate, how they are supporting the New Zealand healthcare industry. So like I said, after completion of this program, students go for the CAP exam. If they clear there, they can work as a registered nurse and support the NZ healthcare sector. They can work as a duty manager, community support worker, physio assistant, mental health worker, disability support worker, healthcare tutor. Angeline Anthony, if you see the girl here, Angeline Anthony, she passed out from NZSE and now she is a tutor with NZSE. So if you see the companies, the list of the companies, we are tied up with top-notch New Zealand-based companies which are there in the healthcare sector. And I would also like to mention over here that we also assist for, even for the part-time jobs also, we assist our students, you know. So we have a career cell which will assist our student, healthcare student for part-time as well as full-time job sector. And the companies like Oceana, Medcall, Geneva, Ultimate Care Group, these are the top-notch healthcare companies in the New Zealand. And this is the academic board. If you see Dr. Sadia Faisal, she is the head of school and the program leader. She is the lecturer for over 8 years internationally, and she practiced medicine, gynecologist, and obstetric. We have Helen Vulgar, who is a master in nursing sciences. She is also one of the lecturer. Alma Urbistondo, she is also one of the lecturer with NZSE. So these are the top academic boards. And these are some of the news bulletin. If you can see, I would just share them. And I would just read it also quickly, that aged care worker has officially been identified as an occupation in sustained shortage across the country. Call for more worker to join health and well-being sector. Healthcare sector suffering skill shortage. So I understand that, you know, healthcare is one of the program which NZSE does not have to promote a lot. We get a lot of students from the Philippines, you know, the other markets. So I know that in the heart of every caregiver is a knowing that we all are connected, and as you do, I do for you, I do for me. And here I would also like to thank all the frontliner to take care of us, and I completely finish my presentation over here. If you have any question, I'm open to that right now.
Okay. All right. Thank you. Thank you, Fatima.
Yeah.
I have a question here, no, but before that, okay, guys. So if you have any questions for Fatima, please smash them into the chat box so that we can ask her directly. But one question that we have over here was from Joanne, and the question here is the focus only in geriatrics.
The focus is only in geriatrics.
So she's asking if the focus is only in geriatrics, I believe.
So what does she want to know in the program? The focus is only geriatric, or what are the outcomes if she want to go in geriatrics?
No, I think what she's asking is it just geriatrics?
No.
Okay.
There are 7 papers: geriatric,
right.
Palliative care, primary healthcare, research, work placement. So I think if she want, I can even give her what all are the papers covered up. Not just geriatric, we have 7 papers for total 120 credit. Primary healthcare is covered, rehabilitation is covered, professional practice and legislation is covered, research for healthcare practice is covered, palliative care and geriatric care, both are there. And we have work placement internship for 30 credits. So this is a 39-week program, yeah.
So guys, it's not just geriatrics. There's more to that. In fact, the good thing is after this presentation, Fatima will be sharing her whole presentation with us, so that you don't need to pretty much ask, you know, more of the technical stuff. So that's taken care of already by Fatima. But that's a good question. Thank you, Joanne. I hope we were able to answer your question. Are there exams required like OET?
Yes, so if you are a nurse or you come from the nursing background and you already have cleared the OET exam, so we see as an international student, English is a necessary compulsory requirement. Either we will look at the OET score or the IELTS score or the PTE score, any of this. If you have OET, well and good. If you have IELTS, well and good. If you have OET score, you don't have to go for any other English requirement exam. So yes, there are a lot of profiles we get where we have students coming from the nursing background and they have cleared OET exam. So it is required. Yeah.
Okay, thank you, thank you. Uh, Next question, is there a CAP program directly to be NZRN or NZRN? I don't know what the CAP program is.
It is what, especially for the nursing students, who want to practice as registered nurse in New Zealand. So post completion of this my program, diploma in community healthcare and support, George, we get a lot of students who are not able to directly get into the nursing program in
Correct.
New Zealand, or they want to get, first come and get into the healthcare sector and then pursue their nursing career further. So they first complete this diploma in community healthcare and support program. Then they would prepare themselves and get enrolled in the CAP program, which is competitive assessment program for nursing student. Once they clear this, then they will be able to practice as a registered nurse in New Zealand with some number of work experience as well. Yeah.
Okay. So, all right. There are a couple more questions here relating
Hmm.
to the fee and all that, but let's probably answer that later, guys, kung okay lang. Because anyway, Jay will be here to also answer that. Is this program, so I'm answering more of the technical aspect. So, is this program same for medical technologists as well? Thank you.
Yes, we have a lot of students joining this program from medical technology background also. And if you come from the medical technology program, like background, you enroll for this program. Post completion of this program, you can practice as a healthcare provider, or you can even, pursue your, like I said, for nursing student, we have CAP exams. Then you can pursue your career in medical technology, or if you want to study further, you can even study public health or other programs with universities also, complete your masters also. So yeah, this program is suitable for medical technologists also to join in.
Okay. So Joanne asked a question. Can you please flash again in the screen the IELTS score required? But somebody answered already from Prime. Prime said the IELTS score should be 6.0. Thank you, Prime, for
Yes.
answering.
Yeah, so no band less than 5.5 in each module: reading, writing, listening, speaking. We require minimum 5.5, overall 6 bands.
And again, there's a reason for that, guys. No, so again,
Yes.
the reason why the score is such is because in an English-speaking country, the mode of communication is just predominantly English, right? So it's important for us to be able to understand, no, that piece of being able to pass that language assessment. If it's okay with you, Fatima, I have to show a video because I want just I heard about that message, your presentation a while ago. What I wanted was to actually show them exactly what NZSC would look like. If it's okay
Yes.
with you, Fatima, right?
Yes, 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 George.
Okay.
Please go on. Yeah.
So I'd like to show everyone. Let me just share my screen. Right. So I'm gonna show you my screen. Okay, so I have another one to show just so that everyone can see it.
Hi friends, my name is Chinju Mani. I'm from India. I have completed Masters of Social Work back to India. Here I am studying Diploma in Community Healthcare and Support in New Zealand School of Education. Actually, I'm very proud of being a student in here because New Zealand School of Education is one of the best institutions.
What you learned from this program, these are the three keywords. First three keywords.
Oops, sorry.
Inventory step and industrial use. I'll give an example, typical example. Okay, this is a steel rod is invent.
All right, sorry about that. Sorry. Hirap mag-DJ. Okay. Ayan.
Hi friends, my name is Chinju Mani. I'm from India. I have completed Masters of Social Work back to India. Here I am studying Diploma in Community Healthcare and Support in New Zealand School of Education. Actually, I'm very proud of being a student in here because New Zealand School of Education is one of the best institutions in New Zealand. And moreover, the teachers and other faculties in here are very supportive and friendly. So I'm very privileged to study here.
Good. Okay, so next one. I think this next video, maraming Pinoy dito. They're Filipinos here. So let's.
Community health and support to a level 7 program. I get a lot of practical knowledge about the course. What I would love to do is take care of the age and then do my PhD further.
Hi, I'm Johnson Steve Zahn. I'm taking up a diploma in community healthcare and support level 7 here at NZSE. They let the students have the freedom to learn new things and at the same time develop their skills. What I'm looking forward is that to have more job opportunities in the future in healthcare.
I'm Eleanor Marie Robertas, and I'm currently enrolled in Diploma in Healthcare Community Support, and that is level 7 here in NZSE. What I love about NZSE is that all the staff are very accommodating for me to have a great future here in New Zealand, because definitely there is a lot of opportunity for me because of the course that I'm involved with this year.
Grabe, saya-saya nila, no? Okay, let's go for last one.
But I'm here in New Zealand and studying in NZSE, the Diploma in Community Healthcare and Support level 7. The NZSE provides quality of education and staff is really good to support every student. I think they provide us many opportunities, like they give us a first aid training and who's training as well. We have a chance to get a good experience in healthcare.
This is not the first time I'm studying in New Zealand. I have studied with other health provider, but if I compare that, I would say the staff of NZSE are really helpful with all the information, and it's just give them a call and they're there to help.
Currently, I'm working as a healthcare assistant. The good thing about the course, it goes hand in hand with my job. Come here and study in New Zealand School of Education. We are providing a very good quality of education, and you will be very competitive globally.
Due to COVID-19, I think very hard time. We got less hours on job. Mentally, we depressed that how we got some money to survive there. Then that supports us with a scholarship of $2,000, and they give a lot of help to us.
We had suffered such a pandemic throughout, but everything was done by NZSE. They were really helpful. And I would say for your future, career and health, NZSE is the best.
That our sport team is there, our tutor is there, our head of department is there, who give us a positive feedback, who takes feedback from us, and it's really good. And I recommend all the students, please study with NZSE for your bright future.
Okay. Thank you, everyone. Okay, so that short video there was really just to show you what it's like. There are a couple of questions. All right, so
good leaders, the ones that you want to stick around with,
oops,
have a
sorry.
very unique capability.
All right, going back. All right. So there are more questions. It's good that we had that break over there. Okay. All right. Follow-up question. I am asking for CAP program since I am a nurse already for more than 10 years. So if ever I don't want to have the study program, but instead to be an NZRN right away. I think what she's trying to say here is if Jay, yeah, you have something?
Yeah. Yes, George. I can see the question here, all right? So you're a nurse already, you're a registered nurse, and you want to go straight to becoming a registered nurse here in New Zealand. Yes, it is possible, but you still have to go through the Nursing Council. The Nursing Council has several requirements that you have to meet. And once you've met these requirements, they will give you the approval to take CAP. CAP is necessary for all overseas nurses before they can be registered here in New Zealand. So the process, we can go through that later. I have a slide for that, but what we can do now is tell you, you have to meet the requirements of the Nursing Council. You have to submit all the documents. You have to meet the English requirement. And then after that, they will approve you. Once you're approved, you can now apply with a school here in New Zealand to take the CAP, or Comprehensive Assessment Programs, which is about 6 to 12 weeks. And then after you finish that, oh, by the way, the CAP has both academic as well as clinical or internship or practical experience. And then once you pass this, the Nursing Council will now give you the approval and you are a registered nurse. Even if you're not a registered nurse here in New Zealand, you will not be able to work as a nurse. So you need to get CAP, approve that for the Nursing Council of New Zealand to give you your certificate. And once you have a registered nurse license already, please apply right away with the district health boards, with all the hospitals, private and public hospitals here, because you are needed here in New Zealand.
Exactly. Very good. Thank you, Jay. Thank you, Jay. So guys, ganito, there's a lot of questions and please still put them in. It's not that we don't want to answer your questions. In fact, we encourage you to put them in. What I'll do so that we don't have that long break of question and answer, we'll just park it at the end of our presentation so that at least all the questions can be answered. Okay lang ba yun? Let's probably go now to, thank you, Jay, by the way. Jay is our next guest later on, no? Because he's the guy who will actually walk us through the whole process. So Jay is like your guru when it comes to this portion, no? of the migration and the education pathway. So Jay will tell us, as it is later on, the whole 9 yards how to accomplish. Pero for now, siguro what we're gonna do is, I've shown you a couple of videos, and thank you by the way, Fatima, for sharing that very wonderful presentation. Later on, let's give another chance for Fatima to answer your questions. But I'll probably just call one person who I think can also share with us her experience naman, no, as a student herself in this program. And I'd like to call on none other than Prime Melendres. Prime, hey there. Yes. Yes, I'd like to ask you, Prime, and maybe for the benefit of everyone, kwentuhan mo naman kami. What are you doing there? What do you do? How did you start? What made you want to go there? Everything, and we'd like to hear it. So, your show, Prime.
Okay, so guys, first of all, my name is Prime, and I'm a radiologic technologist in the Philippines. I used to be. So I worked there for more than 5 years. And then I met Tito J. He's the one who actually who helped me to be here in New Zealand. So as of now, I'm still studying, and I will graduate this coming December. So I am a support worker at Ember Services Limited. It's actually a mental institution. So guys, even if you're still a student here, you can actually work. There are just some rules that you need to follow, like you're only allowed to work for 20 hours per week. So that is a mandatory. You need to abide by the law unless you will be deported. So it's really, if you're able to find a job here, so while you're studying, you can provide for yourself. So when I actually got here, March 13th of March, that was actually 1 week before the lockdown. I was really very fortunate to be already here in New Zealand before the lockdown. So finding a job is really a challenge because, they really don't want the virus to spread. But eventually, I got a private employer. I I'm still taking care of her. She's a disabled person. She's a wheelchair bound person. So I'm giving her, personal cares. So that was actually my sideline. Filipinos, you know that. She actually, my private client that kept me like, made me pay for my bills here, my rent and my food. So if you're a very hardworking person, if you're someone who's not very choosy when it comes to work, you can live here. You can provide for yourself. So I am also a student here. From what Fatima discussed, I am taking the Community Health and Support Level 7. And actually, when I graduate, I will be qualified like healthcare assistant, a support worker with a level 4 qualification. So for the level 4 qualification, from what Fatima said, you'll be earning like 25.50 per hour. Bayaran po kasi dito is per hour. So by next year, we will go up to 27 New Zealand dollars per hour. That will be on July 2021. So some of the challenges actually that I experienced before coming here, of course, the money. And once I got the money, of course, the documents. So don't you worry about that because Tito J will help you all the way in when it comes to documents. And aside from that is of course, the agony of waiting for the approval of immigration. But once you've gathered all the right documents, you need not to worry because most probably you will get approved. So what else? So let's talk about studying here. Actually, it's really different from studying in the Philippines. It's like for me, I felt like I was getting a doctorate or a master's degree because it's more on research. It's really more on paperwork, like 2,000 words, assessments, something like that. But I know all of you can do that. Ano lang yan sa inyo, mani lang yan sa mga Pilipino. Because we know, Filipinos were very fluent in English and kayang-kaya nyo yan. And what else? Well, I would like to talk about New Zealand. Well, in here, you can really never go wrong. First of all, the place itself is very close to nature. It's really a good place for you to settle, to have a family, to get old, actually, to bring your family here. Yes, and in the future, that's what I really wanted to do, to bring my family here. And residency, it's really achievable here. Once after you study, you apply for a work visa, and then after that, you gather all your points. For us as health in the healthcare field, it's really achievable because here in New Zealand, we're in demand, especially RNs, actually, very in demand. So once you've gathered all your points, you can apply for residency, and I believe it's 100% approval. Am I right, Tito J? You think so?
Yes, you will be. You will be approved.
Yes.
Yes.
It's just that for me, everyone should like hurry to go here because each year the immigration is like they're giving out rules and regulations and things like that. So, pag pinatagal nyo pa, baka in the long run, mas mahirapan kayong makapasok to bring your family. So, for me, I believe it's best time to come here to process your papers. And since COVID is still there, you know, healthcare workers, they're really in demand here. They're really looking for us. Okay,
Okay.
so that's all. George, do you have any
Prime,
question?
Prime, just a
Yeah.
question.
Mhm.
What's your life like there? I mean, anong buhay mo dyan? How do you spend your life there? I mean, obviously it's not just studying, no? But how's your life there?
Well, here in New Zealand, they're very into they call the life balance, life work balance. You cannot like work kumbaga sa Pilipino, yung kayod kayod kalabaw, hindi siya ganito. So there will be the companies will be the one to like demand you to have a day off, a holiday because they believe that while you're working you also have your own life. So you need to like enjoy it. You need to take a rest. So since now only allowed to work 20 hours per week. So after I fill in the 20 hours a week, I get to like just uh take leisure, go to the park. Yeah, actually, most of the time I spent in my room. But when I'm with friends, we go biking. We go to the park. There's a lot of parks here that you can go walking distance, name it. And just a matter of 1 hour drive, you'll be in a beach with beautiful scenery. And people in here, uh, they're very much rule abider, you know, and it's really something that uh, na I am impressed with the people in here.
In other words, walang pasaway, no?
Meron din, pero in that especially when it comes to traffic rules,
Yeah.
sila dito they really abide by the rules. Traffic, speed limit, hindi natin maiiwasan meron talaga, but still mas marami yung talagang nag-aato sa law, sumusunod sa law.
Yeah.
Or
There's
else they'll end up in jail. Or
They end up in jail.
demerits.
Actually, just to give context to what you said a while ago, Prime, no, about the requirements, every year New Zealand is tightening, changing policies. I think it's not just New Zealand. I think all countries, especially, not because they want to be tighter, but I think it just has to be trying to address certain requirements of the times. No? Like for now, because there's a pandemic, no, obviously policies will have to change. But I don't think it's a restriction. No? I think, and again, the good news is the borders are going to open soon once this pandemic is over and done with. Things will go back to normal, and I'm 100% that it's not just it's not just people going to normal, but everything else. Business will be in the upswing, requirements will abound, and I also know that even the population back there, people will really demand for more healthcare. Just a question from somebody. Ito, hi Ma'am Prime, how did you, okay, sige, later on na lang yung food and lodging kasi Jay will answer that. Since when did you arrive? When did you start studying, or how long have you been studying now? Coming from Joanne.
I arrived here last March 13.
Okay.
Yeah, so after just 3 days of going to campus, nag-lockdown na kami. So the school decided to give us online classes. Yes, and now I'm actually doing my work placement. It's more or less a 2 months, for 8 weeks, 8 weeks work placement. And after that, this coming December 12, if I'm correct, I'll be graduating. It's actually a 10 months course. Am I right, Fatima? 10 months
Yeah.
course. Mm-hmm.
Actually, this covers 32 weeks, delivery and 7-week holiday. So 120 credit is divided like that. So you would be graduating, you said, in December.
Yes, December, most likely second week of December.
Correct. Yeah.
Mm.
Yeah. So 39 week I mentioned, including the holiday weeks. So 7 weeks holiday and 32 weeks is the actual program. Yeah.
Good. Okay. One other question, Prime. How do you divide time for work in school and studying? Because somebody wants to know exactly the time you spend.
Mm-hmm. So actually, the school will give you your schedule. It's just for 4 hours a week. So there are times like for the first 2 months, it's Mondays to Thursday from 9 to 1 a.m. 9 a.m. to 1 p.m. So after that, your Mondays to Thursday class, you can fit in if you have employment. You can fit in the evening or Friday, Saturday, and Sunday. Actually, employers here, they're very flexible. You just give them your availability. They will actually go with when you are available to work. They will not hassle you with time.
Imagine, no? Imagine
Mhm.
an employer
Yeah.
who's like that.
You can
Implement
actually have
work-life
two employers
balance.
here.
Ah,
Yeah, it's actually legal to have two employers.
that's good. That's
Because
good.
they're actually paying you per hour, not per day. So your hours, that's what's paid. You can work. Actually, I've been working like 1 hour per week for my private client, and she would just book me for another 3 hours because I need to be her on her swimming schedule. I need to assist her while she's swimming. I actually get paid just to join them and do their shopping. Things like that. Pero hindi rin may aalis na oh I've been doing their dishes, cleaning their house, something like that. But hindi ako doon nahihiya kasi yun ang nag-ano sa akin dito, nagbibigay sa akin ng pambayad ko ng rent. It's just like cleaning your own house, but you get paid for it. Ano pa bang gusto mo?
Saka hindi, the conditions there are definitely better. Ibig sabihin, hindi naman nakakahiya gawin yun, no? Kasi
Yeah.
it's
But
something that we're
there are
working
some
for.
mentality na I'm a professional in the Philippines. Why would I do something like that dyan sa bansang yan?
Oh
But
my.
here, you need to be positive all the time. You don't need to be very choosy when it comes to work. Because when you graduate here, you'll be level 4, and after that you'll be a professional, and you can work in a prestigious institution, and that it's common to those people who sa mga nag-uumpisa, hardship, hindi naman mawawala yan.
Saka
Kailangan
hindi,
lang.
ang importante dyan yung payback time. Sabi
Yes,
mo nga,
that's
di
true.
ba?
You get
Payback
paid for
time
everything that you do.
and in a few years, payback time. Kasi bawing-bawi ka. Diba?
Yeah.
I mean, kesa naman dito, professional ka dito sa Pilipinas, even professionals here are even the highly paid ones. Yeah, you're paid well, pero what about government services, di ba? What about the institutions that support us here in the Philippines? It's different from another country, no? And again, New Zealand is a prime example. I mean, guys, if you know, just so you know, walang COVID-19 na ngayon sa NZ. Diba? So dito sa Pilipinas, we're still struggling with like 2,000 cases a day. In New Zealand, there's zero transmission. People are enjoying already. So and that's how you factor in how good the government and the institutions are. No, so aanhin mo yung professional title if you're in a place that hindi talaga maayos yung pamamalakad, no? So that's the difference, no? So I guess That's one of the factors that drive people to explore, going there. Prime, there have been there have been a lot of questions here, but most of them are related to number one, how much fees they need to save up, no. And I would rather have Jay answer that if it's okay with you,
Yes,
Prime.
Gertrude.
And later on, guys, anyway, we will have an open forum wherein everyone can just open their camera and ask their question. But now, and thank you so much, Prime. I really appreciate what you've shared. Good luck to what you're doing, and I'm sure you'll make it. Wag mo kami kalimutan once you're okay now. Once payback time is already there, okay.
Thank
Siguro
you.
it would be good to really now focus on the technical stuff because I know a lot of people are asking questions in reference to how do you actually start the process? How much is it necessary for me to go there? What are the restrictions? What are the policies that I need to follow? All of this. And I guess the best person to answer that is Tito J. None other than Jay Aranas, who is the managing director of Right Education. He is our primary go-to person when it comes to answering these questions because he's the expert, so to speak. He's the consultant, and a lot of people are dependent on what he says. No? So that's why I'm really really happy to share his experience to you. Okay, guys. So Jay, please, by all means.
All right, George, let me just share my screen. All right. Hey, guys, give me a thumbs up if you can see my screen. All right. Yep. Thank you very much, guys. Yeah. Kia ora, welcome to New Zealand. I am Jay Aranas. I'm the managing director of Right Education. And just to give you a background, I've been in New Zealand. I'm based in Auckland, all right? And I've been here in New Zealand for 13 years already. And I'm a Kiwi citizen. My family, we're all Kiwi citizens here. And this is my family. And healthcare is very important to me. I have a soft spot for the healthcare industry because if you can see this picture, the picture on the top right, under that word finish, that is my youngest daughter. And she just graduated a few weeks ago from her course Bachelor in Health Science. So, and the beauty about healthcare also in New Zealand is we have benefited a lot from it, right? We have availed of the services and healthcare here is free. But again, during the COVID, we've seen that healthcare people were really in demand because of your skill, and definitely New Zealand needs you guys, all right? And with our business, we assist people who would like to come to New Zealand. So we have clients from the Philippines, we have clients from Singapore, we have clients from the Middle East, from Dubai, Qatar, Kuwait, Saudi Arabia. And we also have one, if you look at this picture on the upper left, that is at NZSE, all right? That is Linda. Linda is actually the first Kenyan client of NZSE. And she graduated already last year, and she's doing very well now in New Zealand, all right? And with the programs, we have offer everything. We have bachelor's, you have graduate diploma, like what Prime is doing. We also have postgrad diplomas, and we also have masters. These are all available for you, and there are subjects available in healthcare in all these programs, all right? And like what Prime was saying and what you guys were asking, there is a pathway for you to have residency in New Zealand. In fact, some of our graduates from this program have already applied for residency. If you look at the middle picture, congratulations, NZSE. This is Janice. Janice is now a registered nurse. She's working in Otago Hospital, that is in the South Island. And were it not for COVID, she would already have her residency. Right? And she also graduated from NZSE. All right, so guys, it is possible for you to be successful in New Zealand. And we will be with you all the way throughout the process that you will go through. All right, and probably the question that you will be receiving is, or asking yourselves is, why do I want to migrate? All right. And why New Zealand? So if you want to justify or why New Zealand is actually one of the most prosperous country in the world. We're first world, all right? And this, if you look at the screen, the Legatum Prosperity Index for 2019, the Legatum Index is done by a UK think tank where they rank 160 countries according to 12 indices. These indices are in business, uh, economy, healthcare, education, environment, personal freedom, and all this stuff. And New Zealand is the 7th most prosperous country in the world. All right. So this is a good reason for you to come. And if you look at the list, 1 to 6 are all Scandinavian countries. So New Zealand is the top country in Asia, Australasia, to be in. And I'm sure you guys would like to live in a prosperous country. Am I correct? Any thumbs up on that? All right. And I guess this is also one of the reasons why you guys should consider New Zealand. I've talked to a lot of people who would also want to come to New Zealand. And this is one of the main reasons why they're looking at New Zealand. It is because we are basically COVID-free. At this time, we are at alert level 1. And at alert level 1, we're basically back to normal, right? There's no need for social distancing. There is no limit on gatherings. Businesses are all open. Students are back to school. We can travel domestically, and we don't need to wear face masks. It is something that has been that we've never done. All right. And just to give you an idea, as of today, there are only 43 cases. These cases are actually in managed isolation facilities. And these are from people who are coming back. These are residents or citizens who are coming back. So yeah, we're basically COVID-free. And we can do everything normally. All right. And in fact, last week, there was a big sports activity here, attended by 31,000 people in that stadium. All right, so we're pretty much contained this virus. And another reason why you should consider New Zealand is because of the quality of life that we have here. All right, like Prime was mentioning, work-life balance. This is also one of the reasons why New Zealand is in the top according to the Mercer Quality of Living ranking. If you're not familiar with Mercer Quality of Life Index, these are what companies look at when they send their employees abroad or expatriates abroad. So for them, they want to bring one of their managers to a country where the lifestyle is better, or it's going to be easy for them to adjust. In fact, Auckland is the 3rd in this rank, and Wellington is 15. So the 2 major cities in New Zealand is highly recommended for expat living, for workers, all right? And proof of this is last August, the Ministry of Industry approved the application of Microsoft to invest $100 million in Auckland because they want to transfer the database in Auckland so that their employees can work in New Zealand. And it was because of COVID, all right? They said, we want our executives to be there because they will be safe. Their families will be safe, and the operations will continue. So this is another reason why a lot of people are looking at New Zealand. And I hope you guys are thinking of this as well. And a lot of people that I talked to in the Philippines, when I showed this slide, they said, yes, I want that. Because in New Zealand, we're the least corrupt country in the world. All right. So we see where our money is going, where our taxes are going, and the government is efficient. So with these parameters or with these indicators, New Zealand is really a good destination, especially if you're thinking of your future, you're thinking of your family, you want to give opportunities for your children. yes, consider New Zealand because definitely you'll be able to accomplish all these here. All right. And some of you would want to come in and work. I'm sure you'd like to come in and work right away. There are criteria that you have to meet. All right. But what I can tell you to do is try applying online. All right. There are jobs available. You can go to this website, www.seek.co.nz, and apply and see if you can get a job offer from a New Zealand company. Now, let me just tell you that when you look at these ads, there's usually a disclaimer at the bottom which says you have to be in New Zealand to apply for this position, or you need the proper work visa to apply for this position. Probably some of you have done that and have experienced that, yeah, you got the same reply. All right. So try it out because there may be a chance that the company can give you a job offer. Now, 95% of my clients or people that I've spoken to have done this have said, no, they have not made it to the short list because they have to be in New Zealand or they need to have a work visa, right? So because of that, they can also check the skilled migrant category and see if they meet the minimum points. But I'm telling you, it's hard to get the minimum points if you're not in New Zealand or if you don't have a job offer. So the recourse that is available for you is to study here in New Zealand for at least 1 year, all right? Now, are you guys willing to study for a year? Yes. The first requirement, and I saw this in the chat box, somebody was asking what would be the score that I need. If you're a nurse and you want to go for your nursing registration, you need to get a 7 in IELTS, 7 in all bands. And if you're taking the OET, you need to score 350 in all bands, all right? If you're taking the diploma in community healthcare and support, take the academic IELTS, you need a score of overall band score of 6 and no score below 5.5. And yeah, somebody was asking also, can I take Pearson? Yes, you can take Pearson and get the score of 50. Now, these scores is valid for 2 years, all right? So there was one in the chat box asking if I think she took it in 2019. Yes, your score is still valid for 2 years. Now, it has to be valid upon the start of your program in New Zealand. So if you're coming in, let's say next year, and you might probably need to take a new one because it's not going to be valid by then. But take note of this, all right? Graduate diploma, all right? Now, some of you might be looking at taking a higher level or studying a higher level. You might be qualified for, let's say, a postgrad diploma or a master's, right? Because we have some students who are taking postgrad and masters. So these are the scores that you need to get. Overall band of 6.5 and no score below 6. And guys, please remember, take the academic programs, all right? And a lot of people are saying, okay, I'm going to study. I would like to study and I want to be in New Zealand, so I'm going to study. And what are the benefits of coming to New Zealand on a student visa or studying? All right, number one is the quality of education that we have, because if you get a qualification in New Zealand, it is recognized worldwide. So if you want to work later on in Canada, UK, the US, or Australia, your qualification here is accepted. Diba? In our case, coming from the Philippines, when we go abroad, our qualifications is not at par with the programs of the foreign country, all right? And of course, it's cheaper to study here rather than studying in Australia or Canada or the US or UK. And ito yung maganda. This is what Prime was saying earlier, that she is able to work while she's studying. So you guys, during your studies, during your study term, you can work 20 hours a week, all right? And during your term break, you can work full-time, or you can, during your term break and summer, you can work as many hours or full-time. And the minimum wage, like what they mentioned, is $18.90. So this gives you about $370 a week as income. And this may be enough to support yourself, all right? So you'll be able to pay your rental, you'll be able to pay your utilities, your transportation, your communication. But you probably will have to cook your food. You won't be able to eat outside every day, because if you do that, then you might be dipping into your savings. And mind you guys, all right, in the healthcare field, they're actually paying above the minimum. We have students who are earning or who are being paid $20, $21, $22, $23 per hour. All right. So hopefully you'd be able to get that as well. Now, there was another question which says, my husband, all right, I'm being my husband or no. With that, okay, we can also work. We'll go to that later, all right? But with this part-time job, like what Prime said, you have to be open, because we have students who are working as in the call center, customer service, in retail, in hospitality. Some are working as dishwashers in the restaurants, but it's all right because you're paid the same as everybody else, all right? So as long as you're getting work, that's fine, because that is also part of your New Zealand work experience. Now for the nurses, we have a lot of nurses. When they arrive, within the first 2 weeks, they are able to find part-time jobs right away. All right, and this is because you're needed here. There are lots of job openings for you guys, and we also have a network of our students and our friends who know where these openings are, so they can always refer you. But the first requirement for you to be able to work in the healthcare like a nurse, all right, is you need to have a car. But it's easy to get a car. We'll discuss that later on. All right. Now, with the studies, it's usually just 20 hours a week. So you'll be able to do studies, you'll be able to do your assessments, and do your part-time job. Now, after you finish your program, like Prime, for example, she finishes in December. After she finishes, she is also entitled to stay further in New Zealand legally on a post-study work visa. So the post-study work visa, if you're taking the diploma in community healthcare and support, you can stay for another 2 years if you study outside Auckland and you finish your program by December 2021. All right. So our students now, like Prime, should be entitled to this. She'll be able to stay for another 2 years in New Zealand on her post-study work visa. So we'll discuss this also. We can do this later on as well. All right. And once you have a full-time job, you already have a work visa. And after you have your work visa and you meet the requirements under the skilled migrant category visa, you have a pathway to residency. All right. And after 5 years of being a resident, you have the most powerful passport in this post-COVID world. You can apply for your Kiwi citizenship. And don't worry about it. You can still maintain your Philippine passport because the Philippines allows dual citizenship. All right. So guys, if you look at your timeline as a student, you come here and study a year, you're given a 2-year post-study work visa or a 1-year post-study work visa. And then after that, you have full-time work. After 5 years, after that, you get your residency. After 5 years of being a resident, you get your citizenship. So 7 years from now, 8 years from now, would you like to be a citizen? Is this part of your plan? Are you looking forward to this? This is what is available for you by studying in New Zealand. All right. So these are the programs available in healthcare. Of course, there's the Masters of Health Science, because some of you will probably be doctors and you might want to pursue being a doctor here. So you might want to take the Masters. You can also take a postgrad diploma in health science, which is level 8. And of course, diploma in community healthcare and support, level 7. Bachelor of Nursing, if you have children or you're still in high school and you want to study nursing, yeah, you can take a bachelor's here and other certificate courses. The certificates, these are for 2 years. So looking at this, the Diploma in Community Healthcare and Support Level 7 at NZSE is very attractive because it is just for 1 year and you get your post-study work visa. And you can work right away after you finish, right? And there was a question earlier about being a registered nurse here. What I recommend is you check the Nursing Council website for all the requirements, all right? And then you have to have the registration in the country where you studied nursing and where you're practicing now. Plus, you have to justify that the qualification that you got is comparable with New Zealand, and you have to be working for at least 2 years as a nurse in the last 5 years to be able to qualify and submit your application. English requirement 7, as I mentioned, and once you have that, apply, and then the Nursing Council will approve you to take your CAP. And the CAP is for 6 to 12 weeks. After you finish your CAP, congratulations, you're a registered nurse in New Zealand. So this is one pathway that you can do. Now, in some of the cases that we have, some of our students, they weren't able to meet the requirements of the Nursing Council. So what they did was they studied the Diploma in Community Healthcare and Support so that they can come to New Zealand and then work on the requirements, all right? So a lot of our nurses have done this because they couldn't meet the English requirement, and with the NCSE, they help them with their English so that they can meet the seven band. And this also gave them the opportunity to experience the healthcare system here because it's totally different from the Philippines and even in other countries, right? Because the emphasis is different. And you also would like to experience the technology, and even the terminology is sometimes different. So it's a good training ground before you work as a registered nurse, right? And question has always been, can I find work? Is it easy to find work in New Zealand? For you guys, it is very easy. There are 220 private hospitals and public hospitals. There are 673 rest homes. And are the jobs available? If you look at this, you can go to seek.co.nz. This was the information that I had yesterday. There are currently 1,430 healthcare jobs available. Nurses for aged care, it's 169. Community, maternal, and child health, there's 102 jobs available yesterday. Somebody was saying in the chat box, what about maternal and child? Yes, you have this available for you as well, all right? So yeah, it's not just geriatric, there's also community, maternal, and childcare, also general medicine and surgery. So some of you may be working as a nurse in the emergency room or in cardiac and the other departments, right? And yeah, you can also do social work, counseling, and psychology. There's 190 jobs available. So guys, there's a lot of opportunities for you, all right? So community health worker, Fatima mentioned already the salary pay, all right? Registered nurse, yes. Health services manager, yeah. So there's jobs available, all right? And all it has to do now is for you to come to New Zealand and start the process. All right. Thank you, George. Thank you, guys. I hope you have you got the information that you need. I have some information later, but I'm sure that's going to be that will be asked in the Q&A. So I'll show it later when we have the Q&A.
Hey, thank you, Jay. Okay, very exciting yung yung mga sinabi mo. Pero siguro para lang to take care of our backlog, there are a couple of questions, Jay. I'm sure some of them you already answered, pero just to repeat some of them. Sabi dito, can you please repeat the requirements to be able to apply? Yes, obviously, we will not just repeat the requirements. We will send to you the presentation, and then later on we will share to you something so that at least you'll be in touch with everyone in this webinar, no? So para at least we still have continuity after this, no? Next question, I'm sure nasagot na, pero just to reiterate, can you bring your family during the study program?
With bringing your family, all right, the policy right now is you have to study a master's program for you to be able to bring your family. So with that, the student will have to take masters, like masters in healthcare, in health science. So you get a student visa, your spouse is given a work visa. With a work visa, you can do any kind of work in New Zealand. And the good thing also is you can bring your children with you. If your children are of school age, 6 and above, they can study for free in a local school.
What? For free?
Yes, for free.
Okay.
For free. One of our resource persons, she was supposed to join us, took the master's program. The husband took the master's in health science. She's a nurse. So when they came over, she worked on her CAP. She finished her CAP. She's now a registered nurse. But when they came over, she was able to work full time. And they have 3 sons. All these kids were able to study in the local school for free. And we also have other students who are taking the masters, and same thing. So we can discuss this. Because these are case-to-case basis. Yeah.
Okay.
So, but yeah, that's a general one. Take the masters. Yes, you can come with your family.
Later on, Jay will probably give his contact details so that you can get in touch with him directly, for the case-to-case questions. But okay, very interesting, Jay. Very interesting question, because I would also ask this. Can someone from a non-medical background be able to apply to this diploma program?
Yeah. Non-med, yes. Yeah, Fatima, yes, because I know we have one student or one client I referred to NGSE, and she didn't have a medical background, but they did the interview, and yeah, Fatima, go ahead.
So we till last year we have just recently started accepting students from the non-medical background also, but it is conditional on an interview with the head of school. So if you are able to clear the interview, you can. But like Jay said, you can put the application within 48 hours, business hours. You will get a response from Jay. You will apply through Jay, and he will let you know how you will be eligible and what time the interview will be scheduled. If you are from Philippines, it will be mostly the Skype or telephonic interview with the head of school. So unless you clear the interview, you can obviously apply from a non-medical background also.
Yeah. Were it not for this pandemic, we would already have 2 students with non-medical backgrounds who would have taken the July intake.
Yeah.
They were accepted, non-medical. But of course, yeah, we had 2. But
they cleared the interview round. That's amazing.
They cleared the interview. By the way, I did not coach them. I did not coach them.
You know what? I have actually scheduled a couple of interviews from India and Sri Lankan student around, but unfortunately from those markets, those students were not able to crack the interview. So well done, Jay.
Yeah.
Yeah.
Well, yeah, I guess with this program, you really need to have the heart for it. All right.
Yes.
And you need to have the interest. It's not for everybody. All right. You just can't go into this program, because when we do our consultation, I can already sense if you're fit for the program. If your heart is not into it, then I'm gonna tell you don't do it.
Correct. Absolutely. I think that's the best thing of being a consultant you can give, is a very friendly advice. Yeah.
Mm-hmm. Remember, you're dealing with human lives, so you have to have the empathy, and you have to have the loving and tender care.
Absolutely. Yeah.
Which is our Filipino nurses are known.
Yes, that's true. Yeah.
Very compassionate.
I'm happy to hear 2 students cleared the interview round. Well done. Yeah.
One of them is actually a dentist, because I saw how about dental nursing. One of them is a dentist, and she's taking this program because so that she can come, she can work, And then while she's working, she's going to comply with the requirements for her dentistry. Yeah, so
Great.
dental nursing, yeah, you can take this as well because we have one student coming in, supposed to be this January.
Yeah.
Yeah.
So we had the first student from India who was a dentist who,
Oh,
joined NZSE for this program. So a lot of dentists, a lot of nurses, huge demand of this program. Frankly, I don't have to promote this program a lot because it itself, is such a nice program because student when they study, they refer students. So yeah, because they are getting we are assisting them for part-time jobs also, full-time jobs also, 100% employment outcome, pay equity. I think, guys, you should contact Jay and start your application process because the offer letter turnaround time is only 48 business working hours. So even if you have not done your IELTS, you're preparing for it, contact Jay. He will guide you how to do it. We do issue conditional offer letters also based on IELTS. So please start the process right now. I know students must be thinking, oh, ma'am, when the borders are going to get open. But I would always encourage students to attend such sessions, such webinar, get information, utilize this time, get more and more information, contact the consultant, kind of puzzle them with your questions and apply, put the application and start the process because things are taking time. Even if you get the offer letter, there are other things to take care. There are banking process, loan process. So start the process. Yeah.
Currently, for the information of everybody, Immigration New Zealand has suspended application for student visa, processing the application for student visas, and they will start again in February 2021. So this is actually a good time for you guys to get everything sorted out, get all the requirements. We can get the offer or the conditional offer from NZSE and then get all the documents ready so that when immigration says, all right, we'll open the borders out to international students, we can already lodge your application.
Launch your application.
And
Yes.
yeah, you can be here June, July. Yeah.
Correct. Absolutely. Yeah.
Okay. Thank you, Jay. Thank you, Fatima. Here's a question. Is it possible to do some cash on hand jobs? I don't think 20 hours a week would be enough to survive, especially that the cost of living there is expensive. What is the required? I think the band score for IELTS has already been answered.
Yeah. All right. With regards to cash jobs, all right. I cannot answer that. I'd like to answer that, but remember, you're coming here on a student visa. The stipulation in your student visa is you have to work for 20 hours a week, all right? And the immigration and the IRD is going to know how much work you've done because you'll have to pay taxes if everything is reported, all right? So, but I'm happy to tell you that with our students, all right, with the 20 hours that they're doing, they're able to survive because part of what we do is, what I do for all my clients is do pastoral care. So with that pastoral care, cost of living, we will manage it because I will look for accommodations for you. We will have a certain budget so that you'll be able to meet it and manage your expenses here. Because that's one of my roles, your pastoral care.
Yes.
But when you're here, we can always discuss.
Very good. So yan si Tito Jay nga ang bahala eh. So he's going to help us. Okay. Quick question coming from, of course, later on we can answer. No? I'm a nurse working in UAE, and my husband is also a nurse, but he is currently staying in the Philippines. If one of us will take masters, as you said, the other one will be given a work visa. What is the process for visa? Yeah.
All right. With the process for visa, what I suggest is to do it this way. Email me your CV so that I can review it. And then once I see your CVs, let's schedule a Zoom meeting so we can have our discussion. You can tell me your circumstances. I can tell you the process as well. And I can recommend to you the master's program that you can take and give you all the requirements and all the details. There's a lot of details that we have to go through. I don't think we'll be able to get everything at this time. But if you email me your CVs, then we'll schedule a Zoom meeting and we go through each one. But yeah, definitely masters in health science, all right? So you can come over. So that's a similar case to one of our students who's supposed to be a resource person in the next session. Yeah, so yes, you can do it.
Very good. Galing. Although this is more on costs, no. There are 3 questions kasi on 5 questions on cost. How much will masters cost? I mean, siguro parang estimate siguro, Jay.
Okay. I'll show you my screen. So that's the masters. All right. So let's go with the graduate with the diploma in community healthcare. All right. Okay. So let me just show this to you guys. All right. So the average tuition fee for the graduate diploma is about 20,000 New Zealand dollars. Now the tuition fee for NGSE is a bit lower. I think it's going to be just about 17,500, if I'm correct, Fatima. All in all.
The tuition fee for diploma in community.
Yeah, it's 15,000. Right?
Yes, for Filipino student, it's 15,000 New Zealand dollar. Yeah.
Okay, so assuming it's let's put it at 20,000 because there's insurance and all the other stuff.
Yes.
So and next year we don't know when you guys are coming in, so there may be a salary, a tuition fee increase. So
of course. Yeah.
Assuming it's 20,000, this tuition fee for the whole program, and this is you have to pay this one time, big time. All right. And aside from this, you also need to provide proof that you can support yourself while you are studying. And immigration computes this at 15,000 per year of study. All right. So now it's 35,000. Plus, with the new guidelines for people coming in, you need to be quarantined for at least 2 weeks. And the charge is 3,100. Plus, you have to provide also for your plane ticket, the filing fees and all. So let's put it at 4,000. So the show money that you need to provide is 42,000 New Zealand dollars. All right? Times 30, put it at 30 for easier computation. That's about 1.2 million pesos. This is the show money. All right? Now, with the show money, it has to be in your account for the last 6 months. When we lodge your application to immigration, you count 6 months backwards. That is when the money has to be in. And it can be bank statements, it can be shares of stocks, it can be bonds, it can be mutual funds. It doesn't have to be just bank accounts, all right? It can be from several investment sources, okay? In the event that you do not have this amount on your own, the good thing is you can ask your family member. This can be your parents or your siblings or your relatives. So your relatives who can be your lola, lolo, tito, tita, your cousins, they can act as your guarantors so that you can meet the minimum amount or the show money. But we just have to prove that you are related and where the money is coming from. All right. So this is the show money. The actual is going to be a bit lower, but this is what you will need. This is an investment. This is an investment in your future. All right. An investment for your children. So 1.2, 1.3 million is only one car in the Philippines, right? Will you invest in a car or will you invest in your future? So that's the question that I have. You guys look at this as an investment. And the returns are high because you've seen the salary scale for healthcare workers. Nurses are getting 80,000 on their first year. All right? Healthcare workers, they're going to be reaching 60,000 by next year. So this is your show money. So easily you can recover your investment in New Zealand. Yep.
Okay. Okay. Bakit yung naka-off yung video ko? Teka lang ha.
George, there's a question. What can we use our VUL as proof of funds? What is VUL? Karine, what is VUL? If VUL is an investment instrument, yes, you can use that. It's not just limited to bank deposits. So it can be savings, time deposit, money market placement, shares of stocks, bonds, mutual funds. That is accepted. Okay, yeah, it's an investment product with the insurance. Yes, you can use that. Our students have used that also. As long as there is no, look at the conditions, because there's some that when you pre-terminate, you lose so much. Yeah, but look at those conditions. But definitely, yes, this is accepted.
Okay.
Real
Any
estate
other
property-
questions?
Real estate property is not accepted, because remember, guys, when we go through the process, when they approve you, you have to pay the tuition fee right away. So it will take just 10 days from the receipt of your approval in principle. You have to pay the full tuition fee. So if it's real estate, you still have to sell it, so it's not going to meet the deadline. However, if it is a real estate property and you sell it, you do not need the 6 months minimum term.
Gotcha. Okay. How about the cost for taking CAP or CAP?
Yeah, the cap is about 8,000 to 10,000 depending on the school. All right, because I'm not sure how many schools in New Zealand offer CAP, but they're all over. There's some in Auckland. We have students that I referred to a school in Otago Polytechnic. That's where they took their CAP. It was about 8,000. So if you're going to straight to CAP, we can assist you with these schools. All right, placing you in these schools for your CAP. But it's about 8 to 10,000. That's the tuition fee.
Okay. Very good, very good. Other questions, guys? Who else wants to ask questions? Siguro I'll be opening the floor na to both Fatima and Jay. Prime had to leave, by the way, because she had to go somewhere now. So if anyone else has questions, you can ask them now. You may want to turn on your camera, it's okay. Or you may want to type it in the chat box.
George, I see here. What about other healthcare professions like medical lab technologists from Jess Sam Bernardo? Jess Sam, yes, you can take this program as well. And there's other programs for med lab. If you want to discuss this, just send me your CV. We can give you options because there's a lab tech program. You might want to take that, or you might want to pursue community healthcare and support services. Yeah, so yes, there are other programs available for you.
And also, by the way, guys, all the presentations will be shared, right? If after this webinar, we will be sharing the presentations, and also you can ask further questions after this webinar as well. Do we still have more? Okay. All right. Anything else that you'd like to share, Jay and Fatima?
Yeah. All right. Yeah. So since people were asking already, how the process and all. All right. So let me just share my screen one last time. Yeah. So guys, yep. If you need more information and you'd like to pursue your application, you can email me. All right. And if you'd like to go on board with Right Education to assist you on this, these are our strengths. We are based in New Zealand, so we know what's going on here. We know the opportunities as well, and we know the latest news. And I am a certified Education New Zealand agent. So Education New Zealand, this is a government body that promotes education. And I'm a signatory to the Code of Practice for the Pastoral Care of International Students. What this means, guys, is I should be taking care of you even while you're there, and especially when you are here, all right? So we look for accommodations before you arrive, and then we'll pick you at the airport, and we'll give you the orientation so that your transition here is smooth, and you'll be able to get all the requirements ready. And aside from that, also, like what we mentioned, we have 40 schools. Oh, sorry, it's not, yeah, hold on. Yeah. Sorry about this. Okay. Yeah. And I represent 40 schools here. So with service, it's complete from student visa all the way to residency. And our main goal is we want you to be successful here in New Zealand. So I'm pretty much hands-on. That's why you can call me anytime. If you need any information, any guidance, anything, call me. And we want you to succeed here. And these are my contact details. You can take a screenshot, all right? And yeah, email me your CV. We can have another Zoom meeting one-on-one so that we can discuss your own situations, all right? Especially those who were saying they wanted to take a master's so that they can bring the family. Yep, we'll do it. Send your CV as well as your spouse's CV. And guys, when you are in New Zealand, you will do this together with Fatima. Guys, when you're in New Zealand, you will do the bungee jump together with Fatima. And I'll see you guys next year in New Zealand.
Yeah.
Yeah, Fatima, do you have other things to share?
I would just like to add something is that it was, for me, it was a very good webinar. Thank you, Jay. I am so obliged that I attended this webinar. It was very informative and the information you shared was really helpful. And to all the students attending, I can see so many students was throughout the webinar. They were there from last more than 1 hour session. I think it's almost 2 hours. So guys, this is what the dedication, all the healthcare students and all the healthcare people are quite dedicated. And that's what I like about the healthcare student. And this is why New Zealand value healthcare industry so much, that we provide every assistance, every facilities to the healthcare student. We are, so I would suggest that please utilize, even after COVID, everybody has understood what exactly the role of you guys play, and hats off to you guys for your work. So please start the process, start contacting Jay, put down the application, get more information. Whatever questions you have about NZSE also, you can shoot them to Jay. He will answer you. And if you have any further question, please post it here in the chat group. And thank you so much for joining in this session. And seriously, it's so much to participant has attended the session. Thank you guys. Thank you for listening to us. Yeah.
Thank you, Fatima. I think we have one more question, but before that, let me just remind everyone, Jay already showed his contact details, but to be able to get all the presentations that was done today, please join the Facebook group that we just posted in the chat box. And, we can give you from there all the presentations, all the videos that you're looking for, and even the replay of this session, and also all the contact details of everyone, so that you can ask them directly, both Jay and Fatima. So Fatima will also join us in that Facebook group. So please, everyone, make sure to click on that link that I just shared in the chat box. Please join, and then we will share all the presentations there. Okay. There is one question here. Before I will also show you one short video, guys. There are two questions. Sige, sagutin na natin. Let's answer these questions. Okay, so first one from Zarina. How about those who are sending remittances monthly to the Philippines? With a 20 hours week that is only allowed to work, are they still able to send an amount to the Philippines? Will it be sufficient? Na siguro, ano na lang yan, mas maganda sa one-on-one na lang i-discuss, no?
Yeah, one-on-one na lang.
Better. Yep, one-on-one with Jay. So you can contact Jay directly for that one. And then, which is better, CAP or taking masters, which will be cheaper?
Definitely CAP is going to be the cheaper one because it's just a 6 to 12-month program, 12-week program, all right? But again, depends on your circumstances. So because if you cannot meet the nursing requirements, nursing council requirements, then you're not going to be able to take the CAP. So again, Karine, probably send me an email. You got my details. Send me an email and let's have a Zoom meeting so we can discuss your situation. Thank you.
Okay, very good, very good. Okay, guys. If you don't have any more questions, please address them in the Facebook group. You'd be very welcome to join, and please start joining now, because when we end this session, you will no longer see the link. So it would be good to start clicking on the link and join already. And we hope we were able to provide value. I'm just going to share my screen and just show one video, Jay, so that everyone can see it. Okay, before we say goodbye. Jay, maybe you can just give a short background of this guy. Who is this guy in the picture? Who is this guy?
All right, this is one of our students. This is Kim. He's from Iloilo, and he also took the Diploma in Community Healthcare and Support Services at NCSE, and he graduated just a few months ago, and he's now working on his CAP, all right? But I guess you would really love to hear his testimony. Guys, be inspired, because Kim is doing it already.
Payback time na si Kim. Payback time na.
Yeah, medyo payback time na. And yeah, I guess leave it up to him.
Right, okay. And we can also show this, of course, in the group. Pero there's another 2 videos more. I'm just showing this one video. So abangan nila dun sa group. Okay.
Okay, nice.
What can I say about now is I'm really, really happy on my decision. I'm getting here and studying in NZSC. Kasi step by step is nakukuha ko na yung gusto ko. First, nag-graduate ako. Second, nag-post-study visa ako. Third, I'm on the process of my CAP now and doing my nursing. Fourth, getting there sa residency. And then, fifth, sana madala ko na dito yung family ko. So, sa mga tao dyan na gustong pumunta dito sa New Zealand, what can I advise you is that's the best decision that you are going to take. Kasi sa akin, it's really happening right now. So, what else can I say? Kasi nga, happy talaga ako dito at saka nagagawa ko talaga yung mga gusto ko. At nabibili ko yung gusto ko.
That's the happiest part. Nabibili ko yung gusto ko. That's the happiest part. Okay, guys. So, with that, I think we need to end. So, thank you so much, everyone, for attending today. We really appreciate your time. Alam namin, busy kayo, no? Wherever you are. And I hope you guys would be able to join the group again. Just before we close this session, please join the group dito sa taas, no, so that you can start joining and we can start accepting you, because we will be showing not just the video, not just the part 1 of the video of Kim, but all the other videos, plus a replay of this session, plus of course also the presentations that was shared by everyone. Of course, I would like to thank our guests. I'd like to thank Fatima Sayed for gracing our webinar. We had so much to learn today, Fatima. Thank you so much.
Thank you, George. You've been amazing.
Yes, really amazing. And I hope I know we have another session later, but yes, hopefully we still have you more on our session. And of course, thank you, Jay, for sharing your insights. Again, I know that we don't have that much time, but definitely people can go directly to you and ask you all these questions that they have in the group. Okay, guys?
Thank you very much, George. And thank you very much, Fatima. Thank you, guys.
Thank you, Jay. Thank you. And thank you, everyone, and all the best for your future plans.
Thank you, everyone. Thank you, everyone.
Thank
See
you.
See you.
Yeah.
Stay safe. Stay safe.
Are we staying